This episode is brought to you by Trillium Aesthetics. Let's face it, the weird look is having a moment. When you look around at celebrities, strange-looking eyes, overfilled lips, puffy cheeks, and faces that don't seem to move at all are common. You've probably started seeing this around you at the store or when you're out with your friends. Trillium Aesthetics is the place to go for non-surgical treatments that keep people wondering, did she have something done? What does she do to get such beautiful skin? The team at Trillium Aesthetics prides itself on results that whisper but don't shout. If you're looking for non-surgical treatments to brighten up a dull winter complexion, add a little pout to your lips, or erase some pesky smile lines, call the team at Trillium Aesthetics. Schedule online on their Instagram page at Trillium_aesthetics or visit the website trilliumaesthetics.com. Welcome to the Trillium Show, where we help you make the changes you want to see in your body, in your mind, and in your life. I'm your host, Dr. Jason Hall. If you've listened to the previous podcast on facial aging and the three components of facial aging, you'll know that one of the major components that determines how we age is volume loss. And one of the ways to address volume loss in the office, fairly simply, is with injectable fillers. Now, most of the injectable fillers that we use are made of something called hyaluronic acid, which sounds kind of scary, but is a naturally occurring substance that's found in our bodies. The difference with this stuff is that it's made in a lab, and it has different thicknesses, essentially, based on areas that we're interested in treating. Now, one of the things as a surgeon that kind of drives me nuts is to hear injectors, whether they're physicians, surgeons, or mid-level providers, talking about lifting with fillers, using fillers to lift and resuspend and reshape, almost mimicking the results that you could get with a surgical facelift. This just doesn't happen. And I'm kind of making this to debunk the myth that fillers lift. They don't lift. They fill. They add volume, and you can get a little bit of an illusion of lift. You can get the illusion that the tissues lift just because they've been appropriately refilled. And for patients who have early signs of volume loss, so typically patients in their 30s and 40s, or patients who are anatomically prone, don't have real strong cheekbones, don't have a real strong jawline, we can get the illusion of lift by adding some volume in appropriate places, but we're not actually lifting anything. And there have been some very good studies done. Dr. Val Lambros out in Newport Beach, California, did some very elegant three-dimensional studies looking at this and has shown conclusively that fillers fill, they don't lift. So I'm making this really as a public service to those of you who are out there looking for a non-surgical solution. Fillers do a good job of filling. They do a great job of filling. It should be used judiciously and in the right areas. You don't want to be overfilled, which has kind of become one of the norms these days, is to see these pillow face, huge cheeks, big lips, unnatural contours that you can get with over-aggressive use of fillers. But don't think for a second that a filler is going to lift the soft tissues. It's not. What's going to lift is a surgical procedure. So if you're interested in talking about facial aging and treating facial aging, you really need to see someone who will discuss all of the options available for you and not just go down the non-surgical filler pathway because either they don't or can't do the surgical procedures, which in some cases are the appropriate procedures. Thanks for listening to The Trillium Show. You can keep up with the latest on the podcast at jhallmd.com. Be sure to follow us on Spotify, Apple Podcasts, or wherever you listen to podcasts. If you want to connect with us on social media, you can find us at jhallmd on Instagram and Twitter, and Dr. Hall Plastic Surgery on Facebook. Remember, be the change you wish to see in the world.